Hello students, welcome to the lecture on hospital administration, and after this lecture we will be able to learn the following objectives. Explain the distinction between a hospital and an industrial organization. Describe the hospital ethics. Explain the challenges to hospital administration. Define the condition peculiar to administrative work in hospitals. Explain the role of hospital administrators in legal matters. Examining the counseling as a tool in hospital administration. Let's start with the introduction. Hospital management is a new theory in management faculty. A senior doctor used to perform the role of a hospital manager. However, nowadays everything demands a specialist. Amongst all the things related to a hospital have changed. Many categories concerning medical sciences and hospital have altered totally. There are various types of hospital today, including general hospital, specialty hospital and super specialty hospitals. The categories are regarding to the types of facilities they offer to the people. Eligible professionals are needed for the smooth operating of a hospital. Hospital administration is concerned with planning, organizing, staffing, coordinating, controlling and evaluating health services for the community to provide maximum patient care of superior quality at low cost so as to reduce morbidity and mortality. Let's discuss about distinction between a hospital and an industrial organization. Though hospitals have been compared to industry, there is a distinct difference. The product of a hospital is service to people provided by its personnel with a variety of skills. The nature of the demand for hospital services is also distinctive to the hospital, as admission to a hospital for services is rarely voluntary. Functions of the hospital. The main function of a hospital can be classified into 4 categories. Number one, to provide care for the sick and injured. This can be done by accommodating them according to their physical conditions and financial status. When we talk of physical condition, we mean that some patients are seriously ill and require admission in intensive care unit, while others are not seriously ill and can be accommodated elsewhere. Example, in deluxe room, single room with AC and without AC, semi-private room and general ward, according to their financial status. There may be some patient who may require isolation. In that case, they should be kept in isolated rooms, but the building should be kept away in a good state of repair, pleasing appearance, and providing the patient every mental and physical comfort. Number two, training of physician, nurses, and other personnel. They receive their training in both theory and practice in approved schools and colleges. Therefore, hospital being complex and specialized organization must employ highly trained personnel so that they may train others. Particularly in the branch of medical and paramedical education, different association or council play very important roles. They make surveys of hospitals and accord their approval. Only these approved hospitals can provide training in medicine, nursing, dietetics, pharmacy, physiotherapy, administration, medical social work, medical record library, X-ray and medical record technology, etc. Number three, prevention of disease and promotion of health. It is the duty of the hospital to cooperate with the government agencies. They can treat patients of communicable and non-communicable diseases, notifying to the recognized authorities of any communicable disease of which it has knowledge, assist in vaccination programs of the government, etc. Advancement of research in scientific medicine. In light of the broad social responsibility for maintaining and restoring the health, it is an important function. But no hospital is permitted to do direct experiment on patient. Let's talk about hospital ethics. The Code of Ethics of Hospitals goes hand in hand with the Code of Ethics of Physicians. Both of them are required to follow their ethics to render care to the sick and injured. As far as a hospital code of ethics is concerned, it was developed nearly half-century ago, but the Code of Ethics of Physicians has been in existence since the day of Hippocrates, who lived about BC 460 to 377. Today, the Code of Medical Ethics has become the fundamental law of the hospital and is applicable to all its personnel, including the trustees. The trustees are required to employ qualified administrators to keep accurate records, to provide facilities consistent with community needs, to determine fair policies, to set professional standards, and to provide protection to the patient during their stay in their hospital. Thus, the Hospital Code of Ethics acts as a lighthouse and fixes the responsibility on all those, including trustees, administrator, medical staff, administrative staff, and other personnel of the hospital who have anything whatsoever to do with the care of the patient, to make every effort to ensure that all patients received with utmost skill and efficiency and with the greatest of personal consideration. They should also extend every courtesy and consideration to any visitor of the hospital. They should maintain secrecy with regard to information of a personal nature received from the patient during the course of treatment. They should not ask for any compensation or reward from any patient. Let us now talk about challenges to hospital administration. Challenges to administrative abilities have come from within the health field as well as from the public. Business and professional leaders who were initiated into the hospital scene as trustees of voluntary hospitals. The large number of physicians who comprise the medical staff of today's hospital and who are especially concerned about the facilities and services available for the care of their patients. Professional organizations which prescribe various standards of hospital operation while granting approval to the hospitals. Academicians who are concerned about matching what they teach with the requirements of the patients and hospital administration. Labor demanding standards of employment and working condition at least equal to, if not better than, those prevailing in other industries. Trustees of the trust hospitals, members of registered society hospitals, and shareholders of corporate hospitals, and others who have been their own masters and have been operating with no restraint so far will have to face increasing professionalism threatening their power and existence. These professionals will bring professionalism in running the hospital, meaning thereby decentralizing in decision-making and strategic management to survive in the society. No CEO of any hospital will be able to run his hospital without collecting sufficient funds from his patient rather than from trustees, society members, shareholders, philanthropists, etc. Of late, a new challenge is that of being environment friendly. When the international focus is on a safe environment, hospitals which do not pay enough attention to this sensitive issue will be eliminated from the community either through enforcement of legal regulation or customers' boycott. This has already begun in the West and will certainly happen here too, perhaps within the next 5 to 10 years. It should be remembered that credibility and effectiveness are mutually dependent and proportional. The chief executive officer of a hospital must guard his credibility at all costs. He must be able to provide latest technology and vision. He should push for change when it is required in the interest of the patient, employees and the community at large.
Administrators need to be able to operate and direct a very wide range of services that allow different groups and organizations to act and function differently and also a part of a team. Specific duties can vary by the size, responsibility, and type of the department. Some admins must be able to function and do other tasks that fit other descriptions such as contract management, facility management, and assisting other admins. Facility administrators need to plan, design, and manage buildings, grounds, supplies, and equipment. Contract administrators take care of their preparation, analysis, negotiating process, and reviewing the contracts that have to do with the purchase and/or sale of the equipment, materials, supplies, products, or services. They also work with and negotiate with the employees on their contracts as well. Administrative assistants help with the needs of the manager or administrator and usually deals with the employees and expresses issues of concerns with workers and checks on the equipment and other supplies of the hospital. Administrators need to be professionals who can hold a group of people or staff together and get everybody to work as a unit. They must also be able to provide support whenever necessary and provide proper management to each individual work group so they can facilitate the needs and work in unison to maintain the goal of the hospital. They are also responsible for making sure the facility does not go bankrupt. They are to work with the board of directors and other stakeholders to secure hospital finances. They should create policies that help employees in all departments work together to facilitate the goal of the hospital while maintaining the protection and the safety of the staff and patients alike. A 4-year degree is required, and it may require a graduate degree in healthcare management. Serious applicants must possess an advanced degree in order to be competitive and also a good undergraduate education. Projected employment in 2018 for the healthcare administrative field is 328,800, a 16% improvement over the 2008 employment in the field, which was 283,500. The employment of medical managers is also expected to increase faster than average to make smooth business operations. Another reason that employment is projected to increase is because the demand of healthcare is higher than in the past. But even though the employment is going to rise, it is expected to decrease in hospitals because more and more clinics are being built. In the near future, big-time hospital management jobs will be hard to come by because hospitals will be getting bigger and more complex. The pay will be very high, which means the job opportunities will be much more competitive. The averages for the different administrative positions are typically, the fewer the positions, the less admins and managers will make.
Let's now talk about conditions peculiar to administrative work in hospital. The modern world consists of industrial, commercial, governmental, educational, health and military organization of increasing size and complexity. Moreover, significant changes have taken place in our social, economic and political institutions which have made the art of management so complex as to require a considerable degree of specialization. The difference between administrative work in hospitals and in other organizations can be attributed to the existence of the following condition peculiar to hospitals. The consumer of the services provided in a hospital, the patient, are physically or mentally ill and are rendered services within the four walls of the hospital. As compared with most other institutions of business, government and education, this is an unusual situation and present quite different problems of management. The customers of the hospital, the patients, have individual needs and require highly personalized and custom-made services. The diagnostic, therapeutic and preventive services provided by physicians, nurses and technicians with the aid of expensive and specialized equipment and medication are tailored to the needs of each individual customers. In addition to the more common institutional services and functions such as food preparation, general housekeeping, laundry maintenance, purchasing personnel, credit and collection, and public relation, the hospital also provides a wide range of scientific and technical services such as nursing, dietherapy, anesthesiology, pharmacy, radiology, clinical laboratory, physiotherapy, and medical social work. Also, many of its services are provided continuously round the clock every day of the year. All these services involve many individuals, the ill customer himself, his emotional tense relatives and friends, physicians, technologists, clerks and manual laborers. These individuals who are working, suffering, eating and sleeping within a comparative small space and in an unusual atmosphere, highly charged with emotion and tension. Only a very capable administrator can adequately understand and effectively deal with the human relations problems arising from these constraints. Nurses and certain other personnel must accept direction from both the matron and the physicians under whom they work closely every day. The human relations problems in such situation of dual authority are much more frequent, delicate and varied and complex than in organization where this situation does not exist. Handicapped by low wages, rigid discipline and some apprehension of exposure to disease, hospital personnel are expected to maintain a very high level of efficiency as their functioning affects the lives of patients. Another way in which the responsibilities and activities of the hospital administrators differ from his counterpart in other fields is in the amount and variety of training programs that the hospital has to provide. Training is provided for medical interns and residents 6 months to 1 year, nurses 3 to 4 years, X-ray technicians 2 years, medical laboratory technicians 2 years, physiotherapists 4 years, pharmacists 2 years, medical social workers 2 years, dietitians 2 years, nurse aides and nursing orderly. Classroom, clinical and apprenticeship training methods is used in varying combination. The administrators responsible for planning and operating these various training programs. Very few other types of institutions combine such major educational responsibilities with other operating activities. Just as administration in hospital differs from that in most other fields, similarly, public relations aspects and problems of hospitals are more pervasive, delicate and volatile. The human elements, the consumer, patient, producer of care and services, doctors, nurses and other persons, the variety of community health agencies, the other competing hospitals, the people in the community, relatives and friends of the patient and the conditions and environment in which they are brought together. The hospital present public relation problems of a sort and variety vastly different from those of most other institutions. Hospital waste management is another peculiar condition to administrative work in hospital and has become a burning issue these days for hospital administrators as increased awareness of health and its relative problems amongst the general public has led to the demand for comprehensive health care facilities, which in turn require frequent visit to hospital by the patient to undergo various tests. This results in the escalating amount of hospital waste generating in the environment. This hospital waste is not like domestic waste, but a potentially hazardous waste. Its unscientific disposal can pose serious problems to the public in general and the hospital administrator in particular, as it results in increased morbidity due to chemical and radioactive toxicity in the environment and transmission of various diseases. The conventional waste disposal method does not work at all. Hence, the hospital administrator faces another peculiar problem, what is not faced by a chief executive of a business organization or a hotel in disposing of the waste of their institution. Let's talk about the role of hospital administrators in legal matters. Though all hospital administrators are not qualified legal persons, yet they are supposed to possess sufficient knowledge of the Indian laws to be able to take decisions on legal matters. For example, if he wants to terminate a contract with a contractor who is building a particular portion of the hospital building, he needs to have knowledge of the Nigerian Contract Act. Similarly, if he wants to terminate services of an employee, he should know the provisions of the Industrial Employment Standing Orders Act, the Industrial Disputes Act, and the principles of natural justice. CEO's vision to improve hospital services. The CEO should communicate his vision about the hospital as well as involve the employees at every stop. They should be invited to give their views and discuss how they would work towards the vision. It would be easy to say that such as activity is nothing more than a paper exercise, but it can be very productive and useful because each individual's job contributes towards achieving the vision. The following approach works in good as well as bad times. Share the vision with high and low personnel, leaving no place for suspicion. Share even confidential information, personal hopes and fears to create a common vision and promote trust. Seize every opportunity such as open doors, management by working around networks, etc. to make a point, emphasize values, disseminate information, share experience, express interest and show our care and concern. Recognize performance and contribution of personnel. Use incentive programs whose main objective is not compensation but recognition. Let's now talk about counseling as a tool in hospital administration. No institution can be more sensitive than a hospital because it deals with life and death of its patient. A slightly indifferent attitude on the part of the employees in a factory can reduce production, which can well be made up once they reach an amicable settlement with the management. But this is not so in a hospital. If a patient dies due to indifference or work to rule attitude on the part of the hospital employees, there can be no making up thereafter. Therefore, no hospital administrator can afford to cause resentment amongst his employees. He will have to create a team of dedicated employees who should serve the patient with smiling faces, directly or indirectly, such as employees of nursing, service department or central supply room. To create a team of dedicated employees, a hospital administrator needs to establish a relationship with them based upon trust and confidence. While talking to them, he should not only empathize and be on the same level with them, but sometimes should even communicate something on a very personal level to understand their problems. Like a counselor, he not only needs to deal with their grievances from their standpoint, but also should listen to them with genuine and sincere concern. Therefore, hospital administrator needs to possess the following attitudes: respect, genuineness, empathy, self-disclosure, concreteness, understanding, forgiving, jovial personality, listening, humor. It is strongly advocated that a hospital administrator, like a counselor, needs to be of a jovial and humorous nature, as also forgiving and religious-minded. The aforementioned attitudes will certainly play a significant role than ever before because healthcare institutions are becoming multidimensional and highly specialized day by day. It is therefore suggested that all hospital administrators should not only be qualified administrators, but they should also be well versed in human psychology, legal matters, and counseling techniques. Now, in the end, let us summarize what we have learned in this lecture. A hospital obviously has many organizational and operational elements in common and hotels, industrial organization and educational institution. A slightly indifferent attitude on the part of the employees in a factory can reduce production, which can well be made up once they reach an amicable settlement with the management. As the medical aspect of hospital service became more complex, physicians became administrators. Hospital waste management is another peculiar condition to administrative work in hospital and has become a burning issue these days for hospital administrators. Modesty of the patient is very important. No one, including the treating physician and the nurse, has a right to expose the patient unnecessarily.